Welcome, I'm Dr. Noah, your host for 21st Century Natural Health. I want to welcome you back. I'm going to give you the latest in terms of natural type of healing that's going to take charge of your life and make you happy, healthier, and prosperous. So the first study I want to go over is about garlic and onion, one of my favorite types of herbs that are out there in terms of helping reduce gallstones. Gallstones is a more common type of problem as we get older. It affects lots of different people. Here's a study from the British Journal of Nutrition, December 2008. Showing that people that consume garlic and onions having these sulfur kind of compounds is able to reduce gallstones by 15 to 39%. Pretty amazing. Another favorite of mine from the Orient is green tea, reducing a particular type of risk of endometrial cancer. Japanese study, 4 cups or more a day of green tea was able to reduce this devastating type of cancer by 67%. And that was published in the Cancer Causes Control, December 2008, showing you once again good science, very powerful medicine. A common problem that women have as they get older in terms of hot flashes. I've talked about the hormone replacement therapy being deadly, and just reported on my TV show at napavalleytv.org, showing that hormone replacement therapy is a deadly choice of treatment. Well, here's a study in Gynecology Endocrinology, December 2008. Red clover improves bone density. More women die of osteoporosis complications and breast cancer and cervical cancer combined. And they showed positive effects in terms of women that were taking red clover, which actually has these different types of estrogen modulators. It's a false nomer that they're phytoestrogens. Are actually estrogen modulators. They're able to modulate too high, bring down, too low, bring up. If that wasn't good enough for women, we have red clover in men, published in Urology, December 2008. And they looked at high PSA. It's a marker for a blood test that shows that men are having different types of problems in terms of their prostate not working right. And what they looked at was liver, quality of life, and sexual function. And just using 60 milligrams for over a year, they were able to reduce their PSA, a marker once again that their prostate is sick, by 33%, and it did not change any of the sexual hormones. And it was beneficial to the liver. Very powerful medicine, red clover. Risk of hip fracture increases with vitamin B deficiency. Looking at 1,000 elderly people, looking at B6 and B12 methyl donators. And because those compounds also have a factor in homocysteine, a kind of metabolic breakdown that produces this chemical that's an independent risk factor for heart disease, they were able to show by taking these nutrients 60% are more likely to have a hip fracture if they're deficient in these particular type of B vitamins. And was also able to reduce the homocysteine. That was able to reduce hip fractures, once again, as a deadly type of thing, more deadly than breast cancer and cervical cancer combined, 50 to 70%. And that was published in the Journal of Clinical Endocrinology and Metabolism, December 2008. Dietary fiber and whole grains lowers risk of small intestine cancer. Earlier in my TV show at napavalleytv.org, I was talking about by 2010, the World Health Organization estimates that cancer will be the leading cause of death, surpassing cardiovascular disease. And so in this National Institute of Health, looking at over 300,000 men and 200,000 women, large study, by increasing your dietary fiber, not taking any special type of drugs of anything, whole grains, we're able to reduce small intestine cancer by 79%. If there is a biotech industry or a company that was able to find something like that, people would be crashing through the doors and be making billions of dollars. Here's something very simple. Whole grains and wholesome foods have high fiber content. I've talked a lot about in terms of obesity, not only in terms of adults, but with children. Here's a study in American College of Sports Medicine, 2008, childhood obesity, a link to asthma, another big cause, a problem. I practice in Fairfield in Napa, California, so that's one of the big concerns out here. Asthma is a killer, and if you don't take care of it, it can be a problem. And of course, there's lots of natural things. And so by reducing weight, this Kansas State University was able to show in terms of helping that particular type of problem. We also have in terms of letting teens sleep a little bit more. I've talked about that. I have 2 teenage daughters, and it's kind of hard for them to sleep in all day. And what this study in the Journal of Clinical Medicine, December 2008, showed is that we're able to reduce car crashes by 16.5% if we just move school time from 7:30 in the morning to 8:30 in the morning. Studies now conclusively show because of the rapid type of developmental type of changes, they need 9 to 12 hours of sleep. As we get older, it becomes less. And fatigue causes 100,000 accidents a year, and over 50% of those drivers are 16 to 25 years of age. And in this particular type of study showing that 28% of the high school students fall asleep in school. There's our money going to good use there in school. And 51% have fallen, were driving drowsy, and 17% have reported falling asleep while driving too. Very, very scary stuff. So sleep is one of the Centers for Disease Control. Exercise, eating right, and sleep is one of the primary things of being healthy, not taking more drugs. Stress triggers heart damage. Talk a lot about that. 40 to 60% of all diseases are stress related. This University College from London showed that psychological stress increased the risk of heart disease by 50%. Journal of the American College of Cardiology, December 2008. Light cigarette smokers are sued. It's up to the United States Supreme Court because, yeah, it's deceptive. Just like lots of the information out there is deceptive. And they're being sued because it was deceiving smokers into believing that light and low-tar cigarettes were healthier. What a joke. Estrogen in moisturizers may worsen breast cancer. We talked about estrogen has to be very, very carefully monitored. There's a lot of called xenoestrogens from plastics and cosmetics that increase breast cancer. And now they're showing that in 16 of the most widely used moisturizers, 16 actually had estrogen compounds in it that were not listed. So big concern there. 10% of the European hospital patients suffer from adverse effects. When you're in the hospital, you need to get out of there as quickly as possible because death is just waiting to come, even though that's not the reason why you're there. And so that in this study here showed is that 10%, 1 out of 10 people is going to have a serious side effect. Serious, what are we talking about? Infections, incorrect or delayed diagnosis, surgical errors, and medical related areas that cause 37,000 deaths just in Great Britain. 2 endometrial cancer treatments do not work. We've talked a lot about that, is that chemotherapy only works about 5%. There's a classic study I talked on my TV show, napavalleytv.org. It showed that chemotherapy only extends 5-year survival rate by 2.7%. Nothing to go screaming home about. But it makes billions of dollars, and people think that that's going to be their ticket out. It's not. So removing the pelvic lymph nodes as well as external beam radiation should not be part of routine care. These 2 studies showed in one of the most prestigious medical journals from Europe called Lancet, December 2008. So this is why you can be saved your life by having these procedures. Very toxic, very deadly, and they don't work, plus costing hundreds of thousands. So thanks again for watching. You'll keep watching this as we kind of keep update on the latest in terms of natural health and wonderful things that make your body healthy, wealthy, and wise. Talk to you soon. Thanks. Bye.